Good day everybody. I am Dr. Tushar of DFC India Diabetic Foot Clinic based in Mumbai. As a part of our initiative of these 3-minute talks about diabetic foot awareness, today I am going to talk about blood supply of the foot. Can you see how complex this blood flow is? Blood flows from arteries almost from the knee joint going down into the foot, and as they go in the foot there is a complex arch which intercommunicates between the various arteries. There is one artery which goes on the upper part of the foot. There is one artery which goes from behind the foot. As you just saw, the blood supply of the foot is so complex, so complicated, and all those are like small tubes through which blood flow goes from the heart to the feet. Now, over a period of time, what happens is, because of a process called atherosclerosis, where because of the fats in the blood, which is reflected in the lipid profile, which is a blood test, the arteries get coated, and because they are coated, they start getting narrowed. This is further aggravated in diabetes, and for people who smoke cigarettes or chew tobacco, this process is grossly aggravated. So what happens when the blood supply starts becoming less in the feet? The first thing is a patient exhibits symptoms. He starts getting pain in the feet. He says that when he walks a little distance, the patient starts getting pain. And in some people, there is something called rest pain. That means even when they are resting, the patient starts getting pain. This is an equipment called a handheld Doppler, a simple small instrument which tells us the blood supply of the foot. Can you hear this artery pulsating? This is the sound of the artery. The blood supply which goes from here this way, as I showed you in the diagram, and then goes right to the foot. And this is the second artery, as I told you, which will tell us how the blood supply to the foot is. This was to make you aware as to what is meant by blood supply in the foot and the test which we do. So, the concluding remark is, take care of your feet, see that the blood supply is normal. Of course, there are various other tests, but this is something primarily to make you aware as to what is the blood supply of the foot